Coming up next on At Your Service, we will be discussing the Maryland Consortium on Coordinated Community Supports and mental health resources that are available to families and students in Anne Arundel County. Welcome to At Your Service. Today we will be discussing the Maryland Consortium on Coordinated Community Supports and mental health resources that are available to students and families in Anne Arundel County. And today we have a guest with us, and welcome to At Your Service, and thank you for joining us.
Thank you.
Can you tell us your name, your title, and what organization you work for, and then your role within that organization?
Absolutely. Thank you for having me. I'm Marcie Gibbons. I'm a clinical social worker, and I'm the hub coordinator and compliance officer for the Anne Arundel Mental Health Agency. And I have the great fortune to work with you and other organizations in the county for the goal of supporting behavioral health for our children in the schools and our communities.
Awesome. So tell us a little bit about your background. What brought you into this role?
So I'm going to date myself a little bit. I started in social work actually at the beginning of the HIV pandemic, and I worked in acute care and hospice care. And I loved working with the children, and I worked with adults, but I loved working with the young people I was connected with in hospice, and then I went back and started working in the schools. And I've worked with children and adolescents for the last 20 years in the school system around mental health and wellness issues.
Awesome. And you work with kids at all ages?
Predominantly, some younger, but mainly it's adolescents. And college age, so high school, college.
Can you tell us how this Anne Arundel Mental Health Agency operates and supports just our school community, but then the community at large?
Right. So we're a private, not-for-profit agency that supports Anne Arundel County Public Schools, as you know, but it also supports the entire county in so many different facets. We work with the Department of Health, with the Partnership for Children, Youth, and Families, and we oversee behavioral health in the county, trying to make it more accessible to all of the residents and to educate that there are resources out there if anyone is in need. And if anyone during this call or after the call is feeling like they're in need, we're really lucky we have the crisis response service, which is 24 hours, 365 days a year. You can call, anyone in the county can call, it's free, even in the middle of the night if you have a concern. And that number is 410-768-5522 if anyone ever has a need. Child, adult, it doesn't matter how old you are.
That's wonderful.
Someone is there for you.
Thank you. And I think you mentioned something important. I know with our show, we focus on what supports are available for students, but the Anne Arundel Mental Health Agency supports 0 to for life.
Absolutely.
And they have a lot of services, like you said, for older adults.
Yes.
Yeah, so it's a great. I just wanted to highlight that, and then you can call that number, as you said, right, to get those services.
Yeah. At 365 days a year, there's someone on the other who will answer the phone. It doesn't go to a voicemail and press 1. A person will answer the phone and be there for you if someone is in need.
Wow. Excellent. So when I opened up the show, I mentioned the Maryland Consortium on Coordinated Community Supports, and unless you're in that, you don't know what that is, right?
Right.
I know you mentioned your title is Hub. Hub Coordinator and Compliance Officer.
Yeah.
So to the viewers that are watching, what is the Maryland Consortium on Coordinated Community Supports, and what is your role with that?
Absolutely. And just to reinforce what you said, it's new to all of us, right? Mm-hmm. So, but there's so much hope in it. That's why I'm really humbled and proud to be part of it. But the Consortium on Community Supports, it is a new entity, and they're tasked with developing, not just in our county, it's a statewide framework to expand access to comprehensive behavioral services for our children in the schools and in our communities as well. Obviously, we're working more in the school model here, but it was created by the General Assembly, and it's part of the blueprint for Maryland's future, as you said a little while ago. Mm-hmm. So the ultimate goal is for us to be better. Now, please don't take that as we're not better now, because I think this county is astonishing in the service provision, and the people are so committed to our children and families. But the whole hope is that we want all of our children to be successful. And the consortium is doing that in a couple ways. So the first is expanding access so it's easier to reach. I know, so for so long as a social worker, we used to tease like, you got to be a social worker to figure that out. Not anymore, right? We want this to be super easy to access, high quality behavioral health services. And we're mindful, we know there are probably people out there going, oh, well, there's a long wait list. No, we're going to try to like cut through some of that. And we know some of that will settle down in our post-COVID world, but that's definitely one of the goals. And then another piece is like to improve student well-being. It's not just about mental health. This is about well-being, which everybody strives for well-being, right? And readiness to learn, because if you're not in a good space, you're not ready to learn. And then for the educators out there, and for both of you, supporting the educators, fostering a positive classroom and school campus environment where people are ready to learn and ready to teach. And then promoting sustainability, of course, in a nutshell.
Yeah, in a nutshell. We're going to get deeper into it as we ask questions.
Definitely, because, access is so critical because people, it's just that navigation piece.
Right.
And they'll give up.
Right.
Right? If they get passed around after a certain time, I see a lot of it is trying to like get yourself through a maze, and so people get frustrated. So that's wonderful. But your role in your work with Anne Arundel Mental Health Agency, how does that align with this consortium?
So, well, I would say it's probably a partnership. It's probably a collaboration and a partnership, because the mental health agency has been around for years. I say this as the new kid on the block. They are the experts in the county. I feel humbled and honored to work there, and they have the relationships, because a big piece we all know is we don't want to overlap, right? So if you have this great overview, then hopefully you're not going to overlap services. You're just going to shine a light on the need and help people navigate toward that.
Definitely. And that's really critical, because so when I think about it, would it be a group at a table coming around different agency leads and saying, this is what we have, Anne Arundel Mental Health Agency, I can help you in this part of this whole well-being of a student and a family? Because typically, as a social worker, you deal with that family unit. People are not just individual, we're a larger system.
Right. So I can answer that on two levels. First, like as far as the work toward the blueprint goes, where the community collaboration across different agencies, across the schools, our community agencies, Department of Health, and there is a steering committee with people, so there are eyes from every corner of the county and every corner of the service provision.
Nice.
And then for the families and possibly students who are watching this, obviously when we're talking about our healthcare needs, it's private. So we're talking about service provision up here as agencies, and then obviously on the student level, that's held with the most reverence and regard for privacy. So those things aren't talked about up there.
Gotcha.
It's just service provision.
Okay, thank you.
So when we talk about the consortium, so you laid out, what it is from a high level, and I know that there's a certain amount of money that was given to the state around this, and then Anne Arundel got a certain amount, and then there's this hub and spoke model that people talk about. So can you talk about what is the amount of funding that Anne Arundel County got, and then what is the hub and spoke model? Your title, obviously, you're a hub coordinator. What does that mean, and what does that mean to Anne Arundel?
Right. So I love bicycling. So I use the metaphor literally, and for those of you who like bicycling. So the hub is like the core of it, and then the spokes reach out. The spokes are the agencies, and it was a competitive bid process to be a spoke, and it is a significant amount of money. It was about $120 million for the state, and then about 11 million for the county to roll this out. So it is definitely significant. But the spokes are the, with no disrespect, because obviously these grantee agencies are a great deal more than a bicycle wheel, but those are the agencies that are like moving the services along, if you will. Those are the agencies that are providing the direct services to students and families in need.
And the funding went directly to those agencies to support the schools, correct? Okay.
Correct. Through the schools, absolutely. Because who knows better than our schools what's going on? That's where our children are all day long. And, you know, if you have a child who's in sports, the arts, they're there all afternoon and evening too. So the people on the school campuses know our children very, very well.
Thanks.
And they're our partners. And I say that as a mother and as a family member. The schools are our partners to support the well-being of our children.
100%. So what are some of the agencies that are the spokes that you were discussing? And what are the initiatives that they'll be engaging in? Is there particular initiatives related to those agencies?
Right. So the different agencies, it can be anywhere from developing social emotional learning, which is absolutely critical in our post-COVID world. Just for an example, it's difficult for some children to actually sit at a table together because they miss that learning. And I know a lot of people are like, I'm kind of tired of hearing it, but it's true. And if you look at the CDC website, the Centers for Disease Control, if you're familiar with the ACEs study and everything we've learned from that, every child, every adult, us, the three of us, we have an ACEs score just by virtue of living through the pandemic, which is trauma related, right? We went through a traumatic experience. So to kind of embrace that, not spend too much time, because we spent enough time working on COVID then, but we have to embrace the fallout and embrace the children to kind of get back on track, whatever that looks like. So that it's the services are anything from like social emotional learning, like guided play on the playground, which really is conflict resolution between the two of us. How do we throw a ball back and forth together or share the swings, which is really significant, to group counseling, individual counseling, all the way to my expression is the world needs to stop, and there's the student safety issue, and we need emergency services for the child. So everything from like alpha to omega covers around mental health and wellness.
Yeah.
What about, I know that there was a big focus on care coordination. Can you talk a little bit about those services and how families might be able to access those? I know in Anne Arundel we have a lot of resources, but sometimes it can be difficult for families to actually know which resource to connect. So how did the consortium address some of those care coordination?
We could talk about this all day.
Yeah, absolutely.
But something that's so crucial for us to have kind of in the fourth chair at this table is mindfulness of the social determinants of health. So it goes back to, and a big nod to high school and college psych teachers, Maslow's hierarchy of needs. If there's an unstable roof over the head, or maybe I'm living in a car, or there's no food in the refrigerator, or if my family member is going through challenges, or we know from where we are with the opioid crisis, some of our children have lost family members, caregivers to the opioid crisis. We have to be mindful of the social determinants of health. It's a huge factor for our children's mental health, and it's a huge factor for our family's ability to access services. There can be language barriers. There can be barriers of shame and concern, like, oh gosh, how did I get in this place? And guess what? We're all human. We all have things going on. So that's what's so amazing about like Anne Arundel County Schools, our local LBHA, which is all of the services that support our children and families in Anne Arundel County.
That's the behavioral health agency.
Yeah, all the agencies partnering together, because we all get what it's like to go through tough times, and we need, like, forgive the religious metaphor, but that olive branch to help people to access the services they need. So that could be as simple as, in some of our schools we have what's called wraparound services, which will help access services if things are unstable at home. There are services for our children, translation services. So we're really trying to take a step back. And I say we because I'm a very teeny part of it, but the service coordination is trying to take a step back and say, okay, what our families need so our children can be successful in whatever they pursue.
Thank you.
Thank you.
Thank you. We're going to take a short break. Please stay tuned. We'll be right back.
Welcome back to At Your Service. In the previous segment, we discussed the Maryland Consortium on Coordinated Community Supports. And for the next part of the show, we will be discussing mental health challenges that students are facing and some resources that you can access as parents and families. And we have our guest here, Marcie Gibbons, and thank you for being with us. So my first question, in your previous role as a school social worker, can you talk about some of the mental health challenges that students are facing, specifically adolescents, and then what are those specific things that we parents really need to look for with their child?
Absolutely. Thanks for having me. So, I mean, I think they're on a couple levels. I think we see in the adolescent population in Anne Arundel County pretty much everything.
Mm-hmm.
And I say that coming from working in a hospital setting. But I think if we're like, okay, what's the most prevalent? It's probably anxiety and the different manifestations of anxiety disorders. So and again, if anyone listening to this call is experiencing any distress from mild to severe, it doesn't matter. Anywhere in between those, please call Anne Arundel Crisis Response, and that's super important. We also have another great resource for families to navigate. You can get online if you have access to a computer or your cell phone to the network of care, and you can access services there too. So when we have these conversations, we always want to have resources for people, and we're really lucky. We have a really quite robust NAMI, National Alliance for Mental Illness chapter in Anne Arundel County, so you could Google that as well.
Great. And so you mentioned anxiety. What are some other things that kids are facing right now? What are some other challenges that we see in general that kids are facing?
Right.
I definitely think anxiety. I mean, I see it in my own household.
Yes.
So yeah.
Without a doubt, and everywhere from social anxiety, not being comfortable in groups, and it is like the outpouring after COVID. We are kind of coming back together in this post-COVID world. So it can be social anxiety, it can be anxiety around test taking, or in adolescence, I would be remiss not to say, am I going to make it on the cast of the school play? Am I going to make it on the sports team? How is my SAT, ACT score? Am I going to get into that college I want? And I will tell you, from a dear trusted college counselor I know, I love when they said that there is a college for everybody, and you can kind of feel the temperature come down in the room, right? So anxiety.
That makes me feel better.
It does.
As a parent.
It does. It all works out in the end. And I say that, and I know you're like, well, thanks for saying that, because I'm a chapter ahead of you. I have 3 children who just graduated from college, and I was terrified before, but it does work out. It did work out just fine. Hiccups for all, right?
So I just have a clarifying question. So when you have you have a parent watching this segment today, how does it look different in elementary than high school? We talk a little bit. What are some of the things? Because I think developmentally, they don't always have the language.
You got it. So that's where our school nurses are phenomenal, because they can spot it, and our school counselors and social workers and psychologists and the teachers too. You can see it. It's the stomach aches. It's the crying before school, and not being comfortable about things. And I think that's where we can start the dialogue early. Like, there's nothing you're going to get in trouble with to tell me about.
Right.
We want our children talking to us. They don't have to tell us everything.
Right.
But if you're uncomfortable with something, you're not going to get in trouble. I need to know what it is. Like, you are the most important thing, and you're not going to be in trouble. So yeah, because the anxiety does go down to elementary school. You're absolutely right about that. So we want to keep an eye on that. And if we can reinforce, to me, one of the biggest protective factors for our children and for us too is having that one trusted adult we can go to. So say maybe it's you and I, right? If I'm having a bad day, I know I can call you. You're not going to judge me. You're only going to laugh at me when we're laughing together, right? But you're someone I can talk to, and I'm not holding it by myself. So we can start with the younger children, and even start in high school and college. Like, who's your trusted adult? And my language is, who's your safe person? That's the language I've always used. Who's that person you can call at 3 a.m. when you're at a party and the wheels have come off the car, and it's like, oh my gosh, get me out of here. No judgment. I'll be there, and I'm going to pick you up. And we all need that person in our lives. Coincidentally, that is one of the greatest protective factors for suicidal ideation and planning for children and adults, is having that one trusted adult you can go to. And then we know in so many other areas around volatile situations, telling that one trusted adult, it can be a parent, a godparent, aunt, uncle, grandparent, a coach, a clergy person, whomever, or a teacher, obviously. But we need those trusted adults in our children's lives so they can say, hey, I'm worried about this test, or I'm worried about kickball at recess tomorrow, whatever it is.
Definitely.
Super important.
So one of the things that Ryan and I, we have our daughters are similar in age, and we talk about this all the time, but what role does social media play with mental health challenges?
Right. So, here's the thing. Genie's out of the bottle. Social media is out there, right? It's not going anywhere. So to acknowledge the obvious first, and then, okay, that's a given. How do we as parents or adults in the schools, in our communities, support our children to navigate it in a healthy way? That is critically important. Absolutely critically important. There are a couple things around sleep loss. And I'm not just saying this about our children. It's about me too, about us as adults. Put it down. Put it down. And I know some people say I use it in a lot. Okay, fine. But put the phone down and go to sleep. Sleep is a huge piece. The other piece is I tease students. You can kind of tell from my age how old I am. But I tease them. I'm so glad when I was in junior and high in high school, because I was not the popular kid, that I had no clue of the parties I was not invited to. That ignorance was bliss. And that's the terrifying part today, is that Sunday, Monday, Tuesday, what people did over the weekend. I was like, gosh, I didn't know about that, and I thought we were friends. So that kind of that left out feeling. And then another piece now is the AI piece. Okay, I'm going to give you a scenario. The three of us are having this completely benign conversation. There are programs that can insert vulgar words, probably show us, in ways that aren't dressed as respectfully as we are now. And it looks and sounds exactly like us. So think about it, if we're in 13, 17 years old and we see friends doing this, you can't tell reality from the AI. You really can't. So I think it adds another level of complexity and concern there. There are legal factors there as well, 100%. Of course, which are beyond the scope of my knowledge, but they are out there to protect our children. There are really interesting programs now for people to look into, because I might post something that's probably not the best side of myself as a young person, and think, oh gosh, I want to pull it back. There are now programs you can look at that pull things down. There's a permanency to it, we know that. But now there are advocacy means where parents and children can pull things down that were posted, we all do things, right? So that's a really good thing to know. A piece that's really terrifying to me, and it's hard to say, is the issue of sextortion that's going on right now. And anyone who is connected to a device could be vulnerable to people who are truly predators reaching out, highly skilled at being manipulating our children and grooming them to do things they wouldn't typically do, and then come back and ask for money. And it's so embarrassing that children are giving their money, and this is where the trusted adult comes in, so that law enforcement can be brought in. But it's definitely something to be watching for young people with their devices, because you'll see kids getting, I'm certainly not an expert, but getting upwards to like 1,000 texts a day. Wow. Hundreds of an hour. A good resource if people want more information would be your school staff, a school social worker or administrator. But the Maryland Center for Safe Schools has a lot of information on this topic. As a in addition to the information Anne Arundel County Public Schools has.
Most definitely.
Yeah, I want to go back to what you said, though, that trusted adult and just those open lines of communication, because I do think that's the most important thing. It comes to this balance with social media and the phones and teaching our kids how to navigate a world where they have these devices, but also how to make good choices. And then when they make mistakes, because they're going to make mistakes, how to make sure that they learn from those mistakes. So can you talk a little bit more just about that trusted adult and just like how do parents establish that balance, right? That's a tough thing.
It's hard.
Yeah.
And you could say like, how am I going to do it right now? How am I going to do it tonight? It might balance. So another thing is,
because we as parents mess up too.
Yeah. And I've got a cell phone right over there in my bag, right? Yeah. So I think one thing is for us to like be mindful of our use. Like if you and I just said it. Right. The phone's in the bag. The phone's not sitting here. Like we're talking. We've got comfortable eye contact. We're relatively comfortable and super respectful of each other. So knowing when the phones need to go over here. And obviously, sometimes there's a sick family member or your job requires it. That's a given. But when we can, put the phones aside so that we have these respectful conversations. And then just modeling the appropriate use of the phone. And like we mess up too. That's a perfect human would be really boring. It'd be really boring. But we want perfectly safe people. 100%. Perfectly safe. So so if we can model it with the young people, there are definitely like different apps you can get. I'm not a tech person, but you can monitor the usage on across different apps. We know there are certain apps we won't get into now that that they're not safe, like that where predators are rampant. And I say that, and I have this terrible feeling, but it's true, and we need to know that. And I did not know that for a long time. Right. And I will tell you, as a parent, I had the experience. I was doing something, and somebody was like, "Oh, this app, it's not good," and I was kind of like, well, "What?" This was like 10 or 15 years ago. And I opened it up, and I'm not exaggerating for this at all. It said 50-year-old man wants junior high school girl as a new best friend. And I'm not exaggerating. And it was terrifying because as a counselor, I was struggling between my thoughts as a social worker and as a parent. And my parent was like, my heart sunk. And then as a counselor, I thought, oh my gosh, how do we keep our children safe from this? And I think it's word of mouth. Yes, this stuff 100%. Is out there.
100%. But I just want to thank you for joining us today.
Thank you.
It was a pleasure.
Me.
Yes, absolutely.
And thank you for joining us. See you next time on At Your Service.